When a physician orders a test, the jurors expect that physician will follow up on that test every time. And their logic is this: if you sent me to get that poke or to stand in line at the radiology office, there must be a good reason for it, because you wouldn't have me waste my time or get poked if you didn't need it. And so there's often a disconnect in jurors' minds as patients when a physician in malpractice litigation testifies that, well, that test wasn't important, or I didn't really concern myself with the results of that test. That's a huge disconnect for these patient jurors. Another problem that jurors often encounter in trying to figure out how physicians and patients interact is physician follow-up with patients on critical or non-critical test results. Obviously, in an ideal world, you'd have a one-to-one relationship with your physician, and every test result would encounter a telephone call or an email or something along those lines. Modern-day EHRs with their patient portals, large hospital systems with their patient charting access can solve this information, but jurors do expect their physicians, if they've ordered a test, to follow up on it in some fashion. And a lot of practices are savvy enough to have almost regularized templated follow-up information, letters that can go out, a phone call from a PA or from a nurse. Even something as minimal as that gives the individual patient a lot of comfort in the idea that their physicians do care about these results. If that circumstance is brought into the context of litigation, seeing that kind of follow-up, that kind of care, that kind of attention to detail often helps reinforce the themes that we defense attorneys try to get involved in. That is, that these doctors care. They're good doctors. They order information, they get that information, they evaluate that information, they respond to that information. It's not just a single encounter, it's the entirety of the patient engagement that we're trying to explain to the jurors.